So I already saw that the patient is in a wheelchair and some person is actually helping me with the wheelchair. So make sure I just ask, so is anybody accompanying you today, Mrs. Hernandez? And he answered yes, his brother is helping him out. Then I also been told that the wheelchair had been provided by our hospital, and this is the AMRI safe wheelchair. To make sure, I use the metal, the hand scanner to make sure that it is what it is. So I checked it, everything checks out, so that's good. So I have my patient's screening form. This form, the patient already started filling out while in zone 2 by himself. So this is a very important document. We have enormous amount of crucial information here. We have to know that the patient is safe to scan, and there are a lot of relevant medical information of the patient here. That is very important for us. At this point, I will ask the patient, Mr. Hernandez, why are you here today? He told me that he thought he broke his toe. I asked Mr. Hernandez his doctor's name. Mr. Hernandez, do you know your doctor's name? He answered me that not really. According to him, it's the one in LA. I know that is true. His doctor, he is in Los Angeles. I have his doctor's requisition. I have his address, his telephone number, contact information. So at any point I need to contact him, I can do that. First of all, when I start looking at the form, what struck me is the discrepancies about what are the what happened to the patient, how he listed it, and what is the requisition on the form, the diagnosis. So what happened was the patient is concerned about his big toe. It is right toe, so that's already a good thing because we have a requisition for right angle and he cannot walk. So those are one of the first things of many I would be investigating in this case. So I asked the patient, so could you please explain me what happened? I need this information in order to see, to get a clear picture what's going on here. So patient state that his horse hit him in the foot, and it was really painful all over, but on top of it his right toe started bleeding very much, and it became very painful. He's afraid it got broken because he couldn't take out the shoe safely, easily. It was really painful and it was blood all over. So like to do something, he put the gauze around his toe, stopped the bleeding, and at this point he decided he has to go to the doctor. Okay, so I got the story from the patient. Now it's time to go back to the information, the doctor's information, and clear up with his office if that is exactly what they wanted to do, the MRI of the right ankle, or is something else. So I called the office. They were very nice people, very helpful. They are agreed. They say this is they told me that is the right requisition. They want the right ankle MRI without contrast. So everything checks out. That's great. But also, I used the opportunity and asked them about any imaging had been done to the patient, since the doctor is his usual doctor. And I've been told that, in fact, they did an X-ray of his eyes, because recently he's been complaining. He was afraid that there was some metal in his eye, because he works with metal, and sometimes kind of, according to him, lazy to put the goggles on. So they did an X-ray very fast, and what happened was his reaction is like red eyes and pain, but was not because of any metal in his eyes. They suspect it was like sawdust or something. So that is great. That cleared up another part that's been concerning for me in his paperwork. My goal is investigate every single item that the patient answered yes to. So this thing where they said question number 4, I'm a metal worker, I don't always wear goggles, and maybe my eye was damaged while working by metallic object, and he was not sure. We already cleared up. I called the office. The continuation on the form, most of them are no's to any implants. However, there is the joint replacement, hip, knee, he answered yes to, and he listed the right knee. At the same time, we have the marking on the right knee implant here in the picture, and that matches. That's great. I also made sure if that surgery has been done not less than 3 weeks ago, and that's right, the surgery has been done in 2020, so it's plenty of time for scar tissue to be created. Another one was yes to bone/joint, pin, screw, nail, wire, plate, all that. So I make sure this is nothing separate from that particular right knee joint replacement. He already checked yes. So I asked him, is there another part of the body that he has that stuff? And he said, no, I'm talking that about the joint replacement. That was a big thing, and he remembers it very well. So he knows that he is here for MRI examination. That's awesome. And he also said yes to tattoos or permanent makeup. Yes, I noticed also that he was heavily tattooed, and I made sure he knows that during the scan the heating can occur, like you will feel warmth, and if it is uncomfortable, let me know immediately. I'll give you a squeeze ball as emergency squeeze ball. I'm gonna be right there. So if you're uncomfortable, let me know immediately. I will stop the scan, I will walk in, I will help you out. We'll take care of this problem.